Every symptom of high blood pressure explained. 1 in 3 adults has high blood pressure. Half have no idea, not because there are no signs, but because they're missing them. Here are all 8. Pay attention to symptom 7. Let's go. Symptom 1, headaches. Not just any headache, this one hits at the back of your head, and it's worse the moment you wake up. Here's why. When blood pressure spikes above 180 over 120 millimeters of mercury, pressure inside the skull rises with it. Blood vessels in the brain expand to compensate, and that expansion is what creates the deep, throbbing pain most people just call a bad morning. A 2020 study in neurology found that people with readings above 160 over 100 were 3.4 times more likely to report frequent morning headaches. And here's what makes this dangerous. Standard painkillers don't touch it, because this isn't a tension headache. It's pressure, literal pressure inside your head. Normal is 120 over 80 or below. Above 130 over 80. That's already stage 1 hypertension according to the American Heart Association. So if you're waking up with head pain and you've been reaching for ibuprofen, it's not solving anything. Because you might be treating the symptom while the real problem keeps climbing. Speaking of things quietly climbing, symptom 2 is happening inside your eyes right now and most people don't feel it at all. Symptom 2, blurred or double vision. Your eyes have a secret. They're one of the first places high blood pressure causes real physical damage, and an eye doctor can spot it before a blood pressure cuff even catches it. Here's what's happening inside. The retina, the light-sensitive layer at the back of your eye, is fed by a web of tiny blood vessels. When blood pressure stays elevated, those vessels thicken, narrow, and eventually burst. That's called hypertensive retinopathy. And it affects up to 15% of adults with uncontrolled hypertension, according to the American Journal of Hypertension. At readings above 170 over 110, small bleeds called retinal hemorrhages can occur without any warning at all. Doctors look for a specific sign called AV nicking, where arteries stiffen and begin pressing against the veins inside your eye. It's visible under examination. It's a direct fingerprint of high blood pressure, often before any other symptom appears. Blurred vision, double vision, sudden loss of sight in one eye. These aren't random. These are your retinal vessels failing under pressure. And if vision changes are happening, what do you think is going on inside your chest at the same time? Symptom 3, chest pain or tightness. This is the one people feel, and hope means nothing. Chest tightness linked to high blood pressure isn't always a heart attack, but it is always a warning. Here's the mechanism. When blood pressure stays elevated, the heart has to push harder to move blood through stiffened, narrowed arteries. Over time, the left ventricle, your heart's main pump, thickens trying to keep up. That's called left ventricular hypertrophy, and it's present in 15 to 20% of people with long-term hypertension, according to the American College of Cardiology. A thickened, stiffened ventricle is less efficient. It squeezes harder but delivers less, and the chest feels it. A tightness, a pressure, a squeezing that comes and goes. The Framingham Heart Study, one of the longest cardiovascular studies ever conducted, found that people with hypertension are 3 to 4 times more likely to develop coronary artery disease. Chest pain above 140 over 90 is not a coincidence. It's a signal. And what happens when that same overworked heart starts affecting your lungs? That's symptom 4. And it's the one people spend years writing off as just being out of shape. Symptom 4, shortness of breath. You used to take those stairs without thinking. Now you're winded halfway up. Most people blame age or fitness. But here's what's actually happening. Chronic high blood pressure stiffens the walls of the left ventricle over time. As it stiffens, it can't fill with blood properly between beats. Blood backs up. Fluid leaks into lung tissue. Breathing becomes harder, not from your lungs failing, but from your heart not keeping up. This is called heart failure with preserved ejection fraction, and hypertension is the #1 risk factor, responsible for up to 75% of cases. According to the Journal of the American Medical Association, people with blood pressure consistently above 140 over 90 are 2.5 times more likely to report unexplained breathlessness during daily activity. The lungs are drowning in fluid the heart can't clear, and the person just thinks they're out of shape. Years go by, the heart keeps straining, until the next symptom shows up out of nowhere, with no warning, for no apparent reason. Symptom 5, nosebleeds. Random, sudden, no trauma, no reason. That's the nosebleed nobody takes seriously, and the one that matters most. Inside your nasal cavity are hundreds of tiny, fragile blood vessels. When blood pressure spikes sharply above 160 over 100, those vessels face more force than they're built to handle. They rupture. The nosebleed starts. A study in JAMA Otolaryngology found that patients admitted to emergency departments for severe nosebleeds had a mean systolic blood pressure of 169 millimeters of mercury, not slightly elevated, 169. People with hypertension are 2 to 3 times more likely to experience recurring unprovoked nosebleeds compared to the general population. Here's the line that matters. Occasional nosebleeds, probably environmental, frequent nosebleeds with no clear trigger. Check your blood pressure before you reach for another tissue. The bleed is not the problem, the bleed is the signal. And while nosebleeds are visible, symptom 6 is invisible. It's happening inside your brain, right now, and most people feel it as something far more ordinary. Symptom 6, fatigue and mental confusion. You slept 8 hours, you still feel exhausted. Your thoughts feel slower, words don't come as fast. You forget things you shouldn't forget. You blame stress, life, getting older. But here's what the research actually shows. When blood pressure stays elevated for years, it damages the microscopic blood vessels that carry oxygen to brain cells. This leads to cerebral small vessel disease, and hypertension is its leading cause, found in up to 70% of all cases, according to the Lancet Neurology. A study tracking over 11,000 adults found that those with uncontrolled hypertension were 1.6 times more likely to experience measurable cognitive decline within 10 years, not forgetfulness from age. Forgetfulness from oxygen-starved brain tissue, fatigue that sleep doesn't fix, brain fog that coffee doesn't clear. These aren't personality traits, they're symptoms. And if the brain is being affected, what do you think the heart's electrical system is doing? Symptom 7 is the one almost nobody connects to blood pressure until it's too late. Symptom 7, irregular heartbeat. You feel your heart flutter, skip, pound for no reason. Most people chalk it up to anxiety or too much caffeine. But there's a direct documented line from high blood pressure to a condition that raises stroke risk by 500%. Here's how it works. Sustained high pressure enlarges the left atrium, the chamber that receives blood from the lungs. As it stretches, the electrical signals that coordinate heartbeat rhythm get disrupted. The result is atrial fibrillation, chaotic, irregular heartbeat that no longer follows a normal pattern. Hypertension is the single largest attributable risk factor for atrial fibrillation globally. People with high blood pressure have a 40 to 50% higher risk of developing it, according to the European Heart Journal. And once atrial fibrillation develops, stroke risk increases by 500%. Palpitations are often the first electrical warning sign. That flutter you dismissed, it could be the left atrium already under strain. High blood pressure doesn't stay contained to just pressure. It rewires the heart's rhythm. And while the heart is being rewired, the kidneys are quietly failing, which is exactly what symptom 8 looks like from the outside. Symptom 8, swollen legs and ankles, puffy ankles at the end of the day, socks leaving marks, shoes feeling tighter by evening. It looks minor. It is not minor. Here's what's underneath it. The kidneys are precision instruments. They filter blood using exact pressure thresholds. When blood pressure stays too high for too long, that precision breaks down. The kidneys start retaining sodium and water instead of eliminating them. Fluid builds in the body's tissues, especially in the legs and ankles. This is peripheral edema, and it means the kidneys are already losing the battle. The National Kidney Foundation reports that hypertension is the second leading cause of kidney failure in the United States, responsible for 29% of all cases. And the cruelest part, kidney damage causes blood pressure to rise further, which causes more kidney damage. A loop with no natural exit. 1 in 5 people with stage 2 hypertension will show measurable kidney function decline within 5 years if left untreated. Swollen legs aren't a cosmetic problem. They're 2 organs, your heart and your kidneys, telling you they're already in trouble.